John Quincy Adams said, "If your actions inspire others to dream, to learn more, do more, and become more, you are a leader." Good night, viewers, and welcome to another episode of Pulse Live on Choice TV. Tonight, we have a very special program for you, a program that I consider to be a treat, because I have brought here with me two medical practitioners who are heavyweights in their field. Maybe not as much in brawn, but definitely very much so in brains. Tonight, I bring to you two very distinguished, and I go as far as saying very honorable men, men who I personally admire very much and, definitely share a lot of esteem for. Let me tell you who our guests are. We have with us, first of all, Dr. Stephen King. He is well known as a pathologist, well known as a senator, and I should add, has been awarded the OBE for medicine and his service to medicine and healthcare in St. Lucia. Very much likewise, my other heavyweight here is Dr. Martin Didier. Dr. Didier is a heart specialist who also has done further training in infectious disease. Dr. Didier is recently the recipient of the honor of the St. Lucia Cross, that most of us would know by now is the second highest honor that can be bestowed on a St. Lucian. Our guest tonight will be doing what I think only they can do. Or maybe two or three other people on the island can do. They will take us back and they will remind us of what healthcare used to be. They will assess what healthcare is today, and they will try to give us some guidance as to what healthcare should be in the future. Now, before we get to the actual days, the actual programs, material, there's something that I really want to get from these distinguished guests of ours. I'll start with Dr. King. I want them to share with us their journey, starting from as far back as you want to go, your personal journey to becoming the Dr. King that everybody knows today. Some highlights as to what were the challenges, what were some of the successes, and lessons learned that you might want to share with our viewers. Dr. King.
Good evening, Andre. Thank you very much, Dr. Matthew. I appreciate this. My journey in healthcare, I think, in all fairness, probably starts with my father, because my father returned to St. Lucia in 1962. I was 3 years old at the time, and he was a surgeon at Victoria Hospital. He was replacing Dr. Bennett, who moved to St. Jude Hospital in the south. And I remember throughout my childhood, my father in the hospital, because really, in a medical family, you can't get away from the medicine that your father practices, because it comes, as we all know as doctors, your work, medicine's a vocation. It's not a career, it's not a job. It's more than that. It's your life in many ways. So we live, once you have a doctor in the family, you live with them in their practice. So I think that's where it started for me. I must tell you that as a young adolescent, in my rebellious ways, as every young adolescent is,
you were rebellious?
Very much so. I was very rebellious. Okay. I'll give you two stories on my rebellion. Okay. I first rejected medicine and said I wasn't going to do medicine. I was going to do engineering. I was going to do agriculture. I was going to do something else. But I did eventually go and apply to do medicine. I went to do medicine. But my father and I fell out over the fact that I got accepted to two universities. I got to the University of London and to UWI. This was in 1976. Right. That time, I felt myself, again, rebellion, as a young West Indian male. And if you remember 1976, in Jamaica, in particular in the Caribbean, was a conscious era time. It was a time when we, as West Indian people, were actually trying to feel a new way about ourselves. It was a whole movement, and captured, in fact, in the music at the time. from the Tosh to the Marleys and so on,
Right.
Bunny Whaler and all of them. So I rejected and I went to UE. He wasn't very happy about that. He told me because you don't understand how you limit your options. Interesting point. He had a good point, but
Right.
I didn't go with that. So I went to UE. I had a very good time at UE, learned a lot. UE is a very practical university, got lots of hands-on experience, met lots of great doctors, and got a good network of Caribbean professionals and colleagues. I came back here in 1983. Mr. Cornelius Lubin was the permanent secretary at the time, and Romanus Lansico was the health minister. I was assigned to the Soufriere hospital because that's where there was a DMO post. My time in Soufriere was really, I think, the grounding time and the real germination, I think, of a young doctor, because I was very much a community physician. The Soufriere hospital was a busy hospital at the time. We used to get over 800 admissions a year, over 300 deliveries, clinics between 30 and 60 a day, 24 hours, 7 days a week. There were 2 of us in the district, Dr. Lincoln St. Prix and myself. I had the charge of Soufriere Hospital and he had the environs, but we shared the on-call at Soufriere. But as a young doctor at the time, because I was young, I really truly remember the embrace of the community and getting involved in other things, from the Disaster Preparedness Committee to starting the Alcoholics Anonymous group, together with Nurse Lesmore at the time, who was the mental health nurse who worked with me. He was obviously coming from the Golden Hope Hospital. Right. And that was a great time for me. Then I remember wanting to specialize, and I was interested in 3 fields: emergency medicine, psychiatry, or pathology. Pathology, because during UE, I'd met Dr. Barry Hanchard, who I always admired as the man who seemed to know everything, and he had the panache and the style. You would remember Barry.
Yes, of course, yeah.
All right, so that had kind of attracted me to pathology. Right. When I went to Mr. Lubin told me, Dr. King, pathology is our priority at this point in time, do that. So the question was how to do it. I had gotten a residency post in the University of Toronto to do pathology. However, there was no funding. They were not going to fund me. The Canadians said I could come, but I'd have to fund myself. At the time, Mr. Lubin arranged with Mr. Dwight Venner, who was the director of finance at the time, and they gave me 1 year's salary in advance, which at that time, I could tell the general public at that time, that was 26,000 Eastern Caribbean dollars. I was given that in a check, and I was told, go and come back a pathologist. Go and come back a pathologist. Now, pathology is a 4-year program. But what happened is when I was in Toronto, I went to the Sunnybrook Hospital. I met some great pathologists there. I worked hard, and look, we St. Lucians, we're not easy. When we put our minds to something, we deliver, we work. Right. I worked very hard. I impressed those people. People said, wow, this man deserves more. So when my funding ran out for the first year, my 26,000 EC was done. They took me on their payroll, and then I finished my residency there. I returned to St. Lucia in July of 1989. And just before that, Mr. Lubin, you need some far-sighted administrators in the country. These people are very important. I'll tell you why. 3 years before I came back as a pathologist, Mr. Lubin met me when I was down here on holiday, called me to his office, and he said, we need to have a plan as to how we're going to upgrade the pathology and the lab services. He said, we need, and he told me, go and figure this out. So when I went back up, I spoke to my pathologist colleagues up there as to how we could develop a service. Right. And I got my ideas. I came back. I told him this. I said, we need to automate. At that time, Dr. Didi and I were talking. There was a report in 1988. At that time, Victoria Hospital Laboratory was actually not producing as the government wanted or as VH wanted. The Fitz and Rose private laboratory in town was actually doing more work comprehensively than the VH lab. I told him we're going to automate. And in those days, by the way, we had a little lab, a little concrete lab up by the top of the hill where the ONG wing is. Currently. Right? The minister and the PS said they're going to build a new lab, which they built adjacent to the emergency room, the now Ezra Long laboratory. So they built a new lab. We got in the automated equipment. Right. And I think that lab took off. In addition to that, the Rotary Club had donated a blood bank, a blood mobile that was not being used. We put that on the road. We started collecting blood. Thanks to the great work of people like Mrs. Veronica Lee, who anchored the blood bank for us, the Red Cross that linked us to the Carolinas Center, Blood Center in the United States. It's a Red Cross Blood Center. We developed a blood banking program similar to what the Red Cross does in the United States and implemented it. These are some of the programs I'm really proud of. I'm proud of the blood bank services and the efforts that we did there. We took blood from 700 units to over 2,000 units in a matter of 3 years, thanks to the hard work of the staff there. The Ezra Long lab, I mean, it took off. Pathology. We never used to do pathology in St. Lucia. We used to go to either Barbados or to Martinique. Dr. Joannel would come across and take, and so on. Anyway, it was always done overseas. We started to do all of our own. We've never looked back since then. Yes, we've had some difficult times along the way, growing pains, I would call them. Right. But, you know, really and truly, I think it has been a great experience. As for the forensic work, which was, of course, which everybody thinks about in pathology, we used to have to bring in those days it was Dr. Ramalou from Barbados used to come down. Right. So you could imagine people they'd have to wait lengthy periods of time. There were certain postmortems you could not get because, you just didn't, or the DMOs would have to do, or a doctor would have to do his own postmortem. That's how it was. So all of that changed. I'm really pleased. I mean, pathology is a back office operation in medicine. We are like the doctor's consultant. We are not really in the forefront as such. We are more the foundation,
the backstory,
of healthcare in the health team, right? But I think we were important, right? I think, and I think I was asked this question just last week by a group of primary schoolers. Are you proud, Dr. King, of what you've accomplished? And I had to stop for a minute and think. And I said, no, not proud, grateful. I'm grateful. I'm grateful for a number of things. And I think this is a lesson that I want to share. I'm grateful for the fact that throughout my schooling, because of the way our education system is, I was able to get scholarships all the way through, down to the Island Scholarship to go and do my degree. In other words, my parents did not have to even fund me in my program. These people that I love, this country has helped me walk on my own 2 feet as an independent person achieving their career as a young person. I think that's one thing I'm grateful for. Right. I'm grateful to medicine, Andre, because the knowledge that we've acquired, that knowledge is so sacred. Mm-hmm. I mean, God's greatest creation, a human being.
Tremendous great.
Right? All of us who know medicine and understand medicine have to be grateful for that. And to be able to serve in that capacity, to serve people, I think is just, and to earn a living, as they say, from it. And it's not to say that as doctors we are rich. As you know, we don't make loads of money, but we make enough to live, surely, and more than most. So we have to be grateful for all of that. That is why when I answered the primary schoolers in Grace last week, I had to tell them it's with gratitude that I think back on my career at this point in time.
Agreed. Thank you very much for that opener, Doctor. I think Dr. Didier will take us through his journey. I think you mentioned earlier, Dr. Didier, that you went to St. Joseph's Convent at some point.
Yes, I did. I went to the prep school at St. Joseph's Convent, and I moved from there to first to the Anglican school, and then I don't know why, but my mom, I think it was because of proximity. We used to live on the Darling Road, and then my mom moved me into the Methodist school, where I stayed, and I did my primary schooling in the Methodist school. And I must say, I'm very grateful for those people, the teachers. You have Mrs. Stevens, Miss Ernest, Miss George, and so on. Lots of Hiram Isaac. Some of them are passed, some are still with us. And I must say, I always hold that school dear to my heart because that was my foundation. Yeah. I would say this, that when I left the prep school at St. Joseph's Convent, I didn't know a thing. I actually learned everything at the Methodist. And I must say, I was I would say I was privileged and I was blessed. I'll tell you why I say that. In my family, we never had a medical person, never. And to tell you why, and I wanted to do medicine, I really don't know why, but it was always something that I thought I should do. And I thought that, you know, maybe this was one way I could contribute to getting a better life for myself. Yeah. And I started off I wrote the exams. It was then the city council exams. I didn't get through then. But I was fortunate, and I say that because at the time there was a scholarship program going on in the school. And I had actually, although I didn't get a city council, I was the first from the Methodist school. Right. But I didn't win the, so I got the Reverend at the time, Reverend Swanson, I remember that, he said, well, if the boy got the highest school mark in the school, he ought to get the scholarship. And the scholarship was actually called the Sir Garnet Gordon Scholarship. Okay. It's a Methodist. Now, the irony is, I'm not a Methodist, I'm a Catholic. But the Methodist pastor said, well, we're going to give it to this Catholic boy. And he got the highest mark, and therefore, and that's how I went to St. Mary's. Otherwise, I don't think I would have been able to go to St. Mary's College. And I was very grateful. So I had to work very hard because every year they would assess things and I would move up and get support depending on the performance. And that went on until when I reached, it was a 5-year scholarship, I remember. And it was when I reached the 5th form, the question was, well, how am I going to do the 6th form? Because in St. Mary's at the time, the 6th form was 2 years. So you did the 5th form and so on. But I had worked hard before and had achieved, you know, I had gotten, for example, we had A special form in St. Mary's, and I went from 1A to 5A special. We did O-levels in 4th form. I can't remember, I think it was 7 or 8 at the time. That was, I don't know, in the 5th form you did 11 or whatever. I can't remember all the subjects. It's been a long time. We're getting a little old now. But then I went to 6th form, and then they said, well, you know, if you did so well, we're going to fund you into 6th form. And I was, like I said, I was privileged to have done that, to have gotten that from the Methodist school. Then I moved, and the next question was, where do you go from here? So the question is, well, you go to university, of course. The question is how, and with what money? We had no money. My mom was, she was poor. She was actually an immigrant from Martinique, and I was married to St. Lucian. And but she was always, she never got a secondary school education, but she was the one who was the driving force and pushing all of us and pushing. And so I did a little stint at St. Mary's as a teacher, and I wrote it was the CEDA exams. And I passed, and I got a CEDA scholarship to go to UWI. I had no other choice. I hadn't gotten into any other school except UWI. So I went to UWI, and I went to Barbados. And I started natural sciences because at that time, it was very competitive in medicine, and you had to have almost like 3 A's at the time to get in. I didn't have 3 A's. I got in, and I did the natural science program. Right. While in the program, I had done actually 2 years to be able to in the natural science program. And then every year I would apply to get into medicine. And the second year, almost coming to the 3rd year, I got through. And the question was, do you finish the degree or you go into medicine? So I said, well, you know what? I really did not want to do natural sciences. I always wanted to do medicine. So I said, well, here am I. I'm in medical school, going there. And I took the journey, and I went to Mona. And I must say that the journey to Mona UWI was a wonderful experience, really wonderful. I learned so much, and I actually have absolutely no regrets of having traveled to Mona to have done the degree in medicine. I met a lot of wonderful people. I met my wife. She's a wonderful person, but it was really a wonder. The whole life, the student life was great, and the other people, the teachers, the thing. When I reached medical school, actually, and it wasn't really Mona. I enjoyed Mona more than medical school, because Mona had lots of fun, and there was when you did medicine, especially in the preclinical years, you always were anxious to get into the clinical years, and I did my degree, finished, and then I decided that I loved Jamaica so much that I decided to stay and do my internship in Jamaica. And so I did. And it was hard work, because if you did your internship at the university hospital, most people would not stay there. They would go to the public hospitals where it was easier, it was nicer, it was thing. But at you, they put the screws on you, and you really did. And I rather enjoyed it, because I went through the internship quite easily, and there were two choices. When I finished my internship, the choices were, I really didn't know what I was going to do, whether I was going to do. Internal medicine was never on my mind, to be honest with you. I wanted to, in fact, Professor Winter, I remember saying to me, I want you to be an obstetrician gynecologist, and I actually loved it, and started working with a lot of some of our stalwarts. Dr. Marius taught me how to do C-sections.
Okay.
There was Professor Fedricks who taught me. They were in residency then, so I learned from them. And then I did pediatrics. And then I decided, well, I want to do pediatrics as well. It was thing. So that was that. I left the university, and then I went into private practice in Jamaica. At one of my schoolmates said to me, listen, let's leave this university thing and go into private practice. And we went into a practice in a place called Red Hills Road in Jamaica. And to be honest with you, we put every GP on that block out of business. Because we would open at 8 and 10 o'clock in the night. We would have people, and we'd say, please, let us go home. But I was getting homesick, and I said, I'm going back home. And I decided to take the journey back, and I came back to St. Lucia and was posted at Victoria Hospital.
Right.
They posted me in ONG, casualty, now the ER. And then after the first month here, I was told, you have to go and replace Dr. Remy in Viewport. That was, we had a very forward-thinking CMO at the time. He was actually from Sri Lanka. That was Tony D'Souza. And he said, you go down to the thing. And I said, but sir, I have no car, I have no money, I have no house. And he said, come back tomorrow, I'll fix it up. And he did. I got a car, I got an apartment at St. Jude's. And I actually lived at St. Jude's and did the district clinics and ran the pediatric wards for quite some time, quite some time. With the help, of course, of a lot of volunteers. And St. Jude's was a wonderful place. It was really a wonderful place. There were doctors. I met a lot of wonderful doctors, made a lot of contacts. And it was, the nuns were really something to I mean, they made you feel at home. In fact, Sister Shari at the time used to say that she had three sons. She had Dr. M. Remy, Dr. Martin Didier, and Dr. Stephen King. That was her three sons.
That's right.
And if you knew Sister Shari, you would be glad to be her son, because she was about 300 pounds, and she was a fighter, and really a very positive person, a wonderful person. And these were good days. These were really good days. And we met some wonderful people at the time. And then, again, I was working in the districts. I did 6 district clinics in 1 week. So you can imagine, I did Miku, Tiroche, Deriso, Viewport, Saltipus, Labre. And the 5 days. So we had to double up sometimes and do 2 clinics. I also I did family planning, and we did the family planning clinic in in Vieux Fort. I opened up a pap smear clinic to do pap smears.
Right.
First one in Vieux Fort, and we did a lot of work. We also worked, and I work with Dr. King. We opened the Alcoholic Anonymous groups. We didn't drink, but we were the only non-drinker. But we had to be there, and if we were not there, we would take our thing. And it was with the help of a lot of people. And one of the things I would say is that along the journey that I've had, there have been a lot of unsung heroes.
Okay.
A lot of unsung heroes who have contributed to my life, and some of them have really not been, their stories have not been told. For example, you take Mr. Cornelius Lubin. I would say that, as far as I'm concerned, he was probably the best permanent secretary in the Ministry of Health that I know of. And he was a visionary because thanks to him, the cadre of doctors, especially specialists in St. Lucia, we are here. And I can give you a list of them in a short while. But I'll tell you what my journey into internal medicine was. Tony D'Souza came to me and said, I want you to do medicine. I said, but I really don't like medicine. He said, you have to do medicine, internal medicine. He said, I'll make you a deal. I will find funding for you if you find a place. So I applied to UE. I got through. He said to me, okay, I will find funding for you. And it was really, the person who was pushing that was really Cornelius Lubin. What he said is that, and in those days, there was a group of guys they used to call, he would call my boys. And he had them. He had handpicked a group who he had said in the district. There was Dr. Stephen King, there was myself, there was Emsco Remy, there were a lot of others. And he said, listen, I want to send these gentlemen to study because we need St. Lucian specialists to build the healthcare team. Because in that way, we will then build from the top, you get a specialist who's St. Lucian, you can then build up from the bottom and form what we know of as a health team. And that's how it happened. And I went to Mona, I was funded partly. And one of the things is that the funding was that you got study leave with pay, but when you went there, you had to perform. And as you perform, you got a job. And they said to you, okay, you got to come back as a specialist. And I went to Mona, I got through. And then when I reached my final year and I passed my postgraduate work, I had a choice. I had a professor from my external examiner said, Professor Turpey said to me, I would like you to come and work with me at McGill and do cardiology and work with me. He's a world famous cardiologist. And I said to him, you know what? I'm tired of this university life. I'm going home. And then some of the people in Mona said to me, why are you so stupid? You know, this is an opportunity of a lifetime to go to Canada. But at that time, I had a family, and 2 kids, and I said, how could we fare in Canada, not knowing what we were going to do? So I took the trek back home. And I came back home and came back into the fold at Victoria Hospital to meet Dr. Derek King, who was then, I think at the time, he was probably the only consultant at the time. And we stayed there for a number of years. Dr. King went back into private practice. Then we had others who had come up and joined with us. And it's been a long, long journey. We've had other UE graduates who have come back and come back to, I think Dr. Alphonse St. Rose came back later on, stayed for a while. We worked together, and others have joined, Dr. Romel Daniel. And it's been quite a long journey. And I must say, I've been blessed to have served the people of St. Lucia, because it's not really pride. It has nothing to do with that. Yeah. It's more of a privilege. And to me, it's been a privilege to have served the people of St. Lucia. And the thing is, I've enjoyed it throughout all of this. And I've learned a lot from my patients. I must say to you that when I came and I went to the district, I couldn't speak Patois, but I knew French. And it was the people in the district who taught me Patois, and I'm so grateful to them for that.
Wonderful. Okay, viewers, so we've heard a lot from our two guests about their own individual past, which I think was quite intriguing, quite interesting. I'm happy that they shared in such detail. We'll take a commercial break now. When we get back, we're going to talk about healthcare itself, what they experienced in the past, what they see today, and what we're hoping for in the future. Stay with us. We'll be right back. Welcome back, viewers. You've been watching Healthcare Past, Present, and Future, and Dr. King is ready and willing to take us in the past, back to the
past, back to the future. there's one story that I think I wanted to give. I think viewers would be interested in it. Is the HIV/AIDS story, because a number of this, it was, well, for me personally, HIV/AIDS changed me. And I tried, and what happened, I came back here in '89, and HIV, of course, it started in St. Lucia about '85, so it was up and running, as you would say, in St. Lucia. And of course, in the lab, we do the HIV testing. And I remember the Crusader publishing a newspaper with "Smile, Baby Dies of AIDS," because we had a beautiful child who was a fluoride poster baby. So she had this lovely smile.
Smile baby.
Smile baby. That's why she was called a smile baby. And sadly, yes, smile baby dies of AIDS. And they published this, and not once, but 2 newspapers in a row. Something turned in my chest that day, because I was never the kind of vociferous person that people see as such. I was more quiet. But I think then I realized sometimes in life and medicine, you can't be quiet. You have to speak out. And that AIDS story really, the person that I really, 3 people I really appreciated in the whole HIV/AIDS story. One is Dr. Marie Grandison Didier. This lady single-handedly developed, I think, the HIV/AIDS and STI program in this country, and took it to a level that actually it was the envy of the entire Caribbean. Along that same vein, there was also Dr. Michelle Ohms, who was then, I think she was a senior medical officer of health, I think she was, who gave us beautiful support from the ministry level, right? And the third one I'll come back to in a while. But these 2 ladies and myself, I remember working day and night, because we actually became missionaries on a journey to not only educate solutions, but put systems in place to help people, one, prevent, and secondly, deal with the problems of HIV. Now, you remember those days, there was no treatment, no ARV treatment, because we're now talking about 1990, 91 coming up. The program, Dr. Michelle Ohms left, the program began to suffer. And in 2000, another Didier stepped in, as Joan Didier, and we formed the AIDS Action Foundation, because we felt that the battle, in medicine, we fight disease, pain, and suffering. These are our enemies, and that's all we spend our time fighting. And what I felt is we were losing the ground on the great ground we had gained from the work of Dr. Ohms and Dr. Grandison Didier and myself and others in those times. So we formed the AIDS Action Foundation, and I remember, I think it was in 2002, ARVs became available from the Indian subcontinent at a cheap price. And I remember us, Dr. Grandison and I, when you look at the patients dying of AIDS, and you know that the ARV is available, to me, it becomes an ethical question. If you can provide these medicines, would you not provide them? AIDS Action Foundation, we made that decision, yes. We got the money and we bought the ARVs, and we started to dispense ARVs to our patients who required them. And I remember the ministry at the time hauling us in to chastise and say to stop. We must not do this. And again, something else, because remember, the bone had turned back in 1990 with Smile Baby. Well, the bone was harder now Because you look at the minister and you say, sorry, sir. Mm-mm. You cannot look at dying people in the eye when you have something that you can use with them and you don't give it to them when it's within your capacity. I said, your job, sir, is to get the government to take over this program. That's your job. So get on it and do it. You know, and I mean, I loved those people in that time. And sometimes medicine gives you those opportunities to be involved in things like that. And that is the beauty of medicine. And if it's one thing I want to tell young doctors and young people, you've got to find your passion in this business. No matter what, you have to find your passion. Find your passion in life. And even in your career, find the passion within it too. Because that is when you find joy in what you do. It doesn't become work anymore.
Definitely not.
You know? It's your life. And that is how it has to be. And so these things, and I mean, I've been lucky. That's why I said I'm grateful. I've been lucky to have things like that. But if you had to go back in history, and I think we can share the historical stories.
Yes.
The Solution Health System, you know, as I say, we stand on the shoulders of giants. There are people before us who built systems. Because prior to 1887, there was no health institution in this country, right? Like in 1854, when the cholera epidemic ravaged the St. Lucian population, it is estimated of a population of about 40,000 people, over 10,000 people died in that epidemic.
Wow.
Right? We were living in a time where the life expectancy was under 50 years, where the infant mortality was over 120.
Wow.
Right? If you think about those times, these were dark and dismal times from a health point of view. There was really nothing truly available. In 1887, we built the Victoria Hospital. And I think that heralded the beginning. Soon thereafter came the mental hospital. And then in 1946, there was a big move throughout the Caribbean with I think it's the Frank Stockdale report.
Yes.
That started up on these health units and the concept of taking health care into communities. It was actually the beginning of primary care. The Caribbean has always been ahead in many ways in the world, you know. Right. Before the 1978 Primary Care Alma Ata Declaration, the Caribbean in 1948, with that Frank Stockdale report, had said that primary care is the way to go. And they started to inject the infrastructure into community to bring the services down. 1946, the Soufriere Hospital was built. Soon thereafter, Denry. Then you had all the health centers proliferating, Viewfort Health Center, and all the other health centers started to then proliferate, till we have 34 health centers today. Because I think it was under the Minister Alan Bousquet,
yes,
who was one of our great ministers of health, I must tell you, a great minister of health.
I would add to that as
probably
well.
stands as one of the best. And that's not only my saying. I remember my father telling me that if it is one minister that he would always be ever so happy to work with, it's Honorable Alan Bousquet. They said that there would nobody would be within more than 10 minutes walking distance of a health facility. That was the mantra that the government at the time had. And they tried to deliver on it and came very close to it and gave us a beautiful health infrastructure, which is there for us to now use as we move forward. And I think the other big story to tell in that, and I know Martin has his to add, but two other big stories to tell is one, the human resource development, right, the contribution of UWI and the UK to the development of our doctors from around 1958 when UE came on board, when we started to have our UE grads. But I think the other story that has to be told is a more recent one, is a Cuban intervention with our health, with the upgrading of our health personnel and training of our health workforce. Because from 1980 on, Cuba stands head and shoulders above every other country or government as training our health professionals. And you know, how can you deliver health without health infrastructure and health professionals? So I think that's, in a nutshell, the story of our infrastructure development and our human. Yeah. St. Jude Hospital, yes, which was a Second World War hospital, came in probably in the late part of the Second World
War. Yeah.
Right? The only other story I would like to tell before I pass over to Martin is the schistosomiasis project. Just to let St. Lucians know how we as St. Lucians stand in medical history. 1965, Dr. Peter Jordan and the Rockefeller Institute. Dr. Peter Jordan was a doctor. The Rockefeller Institute was the institute that established, up on the Mon, the schistosoma project. they looked at schistosoma. In those days, we used to get over 300 to almost 400 cases of schistosomiasis every year in this country. Schistosomiasis, Martin will give you more on it, but it is actually quite a devastating disease when you have it. Okay? Anyway, so it's a parasite that you get from the water. And it's carried in the snail, so it has a very complex life cycle between the snail and the human being.
Right.
They between 1965 and 1980, came up with the best public health approach to dealing with schistosomiasis, which really was don't kill the snail, don't do this, don't do that. Actually, what you do is you modify behavior. You modify the people's behavior. You change the relationship between them and the water that carries the parasite. Right. Which is why you would notice that we started to build baths and laundry houses so that people no longer had to visit the rivers, to do especially the rivers that were heavily infested. You know, even up to recently, when we built the Roseau Dam, we had to revisit the whole approach to bilharzia, which is the old-fashioned name bilharzia, the schistosomiasis. We had to revisit it because that river has schistosoma. So we had to go back and revisit as we did that dam to see how we could prevent people from becoming infected. And that book, there's a book that you can get that is written by Dr. Peter Jordan. That book tells you everything you need to know about schistosomiasis, and it's actually the seminal work, the best work that you can get. And everybody from Egypt, all in Africa, this is what they use to pattern their schistosoma projects. Many people, if you ask them about St. Lucia, in health people, especially in the African continent, what they will know is Peter Jordan and schistosomiasis. That's how we are known in those circles in that part of the world. St. Lucian contribution to the world.
Very, very interesting.
Yeah. Well, let me just reiterate a lot of what Dr. King says about the history. A lot of us don't realize that Victoria Hospital, where it stands on a 9-acre site, beautiful site it is, but it is 128 years old. We don't realize that. Opened in 1887.
Amazing.
Yes. And in fact, that was the referral center in the country. And then in 1948, you had the Americans open the war hospital for the rehabilitation of the war wounded from the Second World War. And then that changed the demographics, obviously, in Vieux Fort. And the thing is, sometimes when things happen like that, a lot of things happen. Dr. King we were talking about the fact that that's how the STD clinic started. And it started in Vieux Fort because the Americans had come, and now one of the doctors there opened a clinic called the Prostitutes Clinic, where he was treating the thing because the American GIs would be coming down with syphilis and this and that and so on, so they had to be treated. So that started STD clinics, and Vieux Fort was actually, that's where it started.
The pioneer.
So the pioneer in that. So, and then in 1966, the St. Jude's was handed over to the St. Lucia government, John Compton at the time, through the efforts of, he actually handed it over to the Sisters of the Sorrowful Mother, and through Sister Irma and her group. And these nuns really have been what I call the unsung heroes, because in all this journey that we have had in St. Lucia, from the opening of Victoria to the health centers, Soufrière, Dennery, and so on, there have been a lot of people who actually have been the backbone of the healthcare system. It would take us hours to talk about that. We just have to talk about it in little bits and pieces. So we had that, and then we had St. Jude's, which actually became quite a hospital in its own right. In fact, in the early days, what used to happen is that the hospital of choice was actually St. Jude's Hospital, because St. Jude's worked with a small cadre of resident doctors, and was usually manned by a tremendous amount of volunteers who'd come down for 2 months, 3 months, 4 months, and so on. And with them, they would bring their skills, but they would also bring other people with skills, who some of them paramedical people. They would bring gifts and donations and so on. And it helped St. Jude's to actually become quite a hospital that St. Lucia could have been proud of at the time. So Victoria was still fledgling because at the time we didn't have a cadre of resident doctors there were people who would come and people would go. And what we were saying was that up to 1998, when there was a report called 1988, called the Health Financing Report, which was done by a group called, I think they came out of Stony Brook in Canada. It was Russell et al. Who had this report. What they said, there were 29 doctors working in the health services, in fact, including Victoria Hospital. 29, of which 8 of them were St. Lucians, and the rest were expatriates, various from other places, from other places. And it was important to that sort of number is important, because what you needed to see was that within the Ministry of Health, there were obviously people, and we talk about little giants, who actually push the healthcare system. People often say sometimes politicians don't do things. That's not quite true. If you have visionary permanent secretaries, and who were the technical people who understood the resources that they had in hand, then the politicians could look good. And in fact, the story that comes to mind is, for example, we recently looked at dialysis in St. Lucia. And really on the shoulders of that is Romanus Lancico. If you think about it, he was the one, we started off with, and in fact the story of dialysis probably starts with one of our colleagues who actually had kidney dialysis, and he used to go to Martinique, and through the thing of John Compton and the nephrologist in Martinique, they became good friends, and then people would go over to Martinique, and then through the French, they sent obviously Mr. Lancico across there, and of course because of his speaking skills and his persuasion that we know, he actually persuaded them to give us a number of machines and dialysis for a whole year. Now, that was because the French, had owed the French so much money that they said it's cheaper to give us the machines. So it was fortunate, and the whole story started there. And a lot of us got involved in dialysis. Dr. King was trained, there was thing, and so on. And then
Derek King.
Derek King, it wasn't Stephen's father is the surgeon. It was Derek King at the time. He was trained. He did a little stint for a while. And then I was thrown into the deep end as the new kid on the block. I had just arrived with specialization, and I was thrown into the deep end, and then we moved from there. So there are many things that happened. Dialysis was one, and then we had others as well. One of the things that I always remember about our healthcare system is this. We had a primary healthcare system that we actually were very proud of. I mean, we had in the world, you looked at the rates of immunization was better than in the United States for many years. Wow. It's not as good as it used to be. It's high, but the key people in that were the nurses, and they worked those district health centers and those nurses, and you had some people who did a tremendous amount of work. So that was immunization. Then you looked at other programs that developed. At the time, I remember even the tuberculosis program that had developed. Dr. King and myself were still in the districts at the time, and we would see a tremendous amount of TB. And then there was a consultant who is Bajan. He was Dr. Bud Braffett, and at St. Jude's at the time was a priest who was an internist, Dr. McCarthy at the time, Jack McCarthy, who was a very brilliant man. And in fact, he said, listen, we need to do something about TB. So we sat down as a team, St. Jude's, Victoria, and the districts, and we actually wrote a program for TB. And what we did was we borrowed a page out of leprosy. And leprosy had already an established programs, and there were programs going on. That was Dr. Lal Singh and others, Dr. Nurse Goddard did. And if you look at the districts and the demographics of TB,
Right.
it's similar to where you find leprosy in some of the districts. And so we use the treatment very similar, so we use the same pattern and we develop, and at that time came the DOTS program. DOTS is supervised therapy for tuberculosis, where you shortened, and we had some tremendous persons. We had persons in the district. We had Sister Sarah here, Miss Isaac, Sister Vincent in Viewfort. And Sister Vincent was so aggressive that she would go into the rum shops and she would threaten. She would threaten the rum, the owners, and say, I will tell the inspector to take away your license if you continue to serve rum to this TB patient. And they really did. So there were a lot of people. So it has been a journey, and I think we have a lots of things to be grateful of. Now we have programs that have been created. They haven't reached the level of which we would all want to see it develop into. And some of them have fallen down, some of them have fallen by the wayside, and I think that we have a lot has changed. People say, well, not much has changed in St. Lucia.
A lot has changed.
A lot has changed. A lot has changed from the time of old Victoria to a primary healthcare service. That is not perfect, but it's doing well for a small country. And even in hospital services, we have a lot to be grateful of.
Right.
And I think that we ourselves, we do not give Victoria Hospital, and indeed the people who work within the healthcare services, the praise that they deserve, and we bash them all the time.
Yeah.
And sometimes it's really not because of what they want to do, but because of financial constraints. And that's the whole question, and we'll come to that in a short while.
I think that's a very good point at which to take a break. So when we get back, we'll be talking about exactly what is happening now, what we've lost, what we hope to regain, and what we look forward to in the future. If you'll stay with us, you're watching Pulse, live on Choice TV. We'll be right back. Welcome back. I hope you've been enjoying this very, very informative program. So at this moment, we're going to go into healthcare in the present, and we'll do some comparisons between healthcare now and healthcare in the past. And Dr. Martin Didier will start us off in looking at where we are today.
Well, I must say that we have grown. We've grown to the point where from what we had, a lot has changed. And what happened is that there's a significant change that came about. And I will talk about Victoria Hospital and St. Jude's was really the public sector healthcare service in St. Lucia. And that was in 1996. And even before that, I would say 1992, 1993, a group of us got together and said, well, listen, in order for us to stay in St. Lucia and to raise the bar of healthcare, we need to form a private institution. And Tapion Hospital at the time was born. The term we used was that maybe out of frustration with the present service, and in order for us not to migrate out of St. Lucia. A lot of us had options. All of us, in fact, had options, but we chose to stick together. And a little band of doctors, we got together, and we sat together and we brainstormed. And I can tell you this, we got angry with each other. In fact, we argued for years. And in fact, at the end of it was 2 or 3 years, we really had argued so much that we couldn't get vexed with each other anymore. And the Tapian Hospital was born. And it actually provided a new opportunity for St. Lucians. And it opened, and we thought it was one way of raising the bar of healthcare. And that was what we thought that, because there was a lot of things happening, not just in the international arena, outside of St. Lucia. And some of us had come back. There were new doctors coming in with new ideas. We needed to embrace them. There were people who were here who wanted to introduce services.
Right.
And we needed to do that together as a group. The first attempt at a private institution had been done it was then, I think it was 15 years before that, where Dr. King and a group of people had made an attempt, but it really didn't work out in the way that they envisaged. And maybe when you look back, as a group, maybe they were not cohesive enough, but we were prepared, and I say we, the new group, the new kids on the block at that time, were prepared not to allow this to happen. And we thought that this was what we wanted to do, so that we could deliver a better level of healthcare to St. Lucians. And Tapian Hospital was born. So that was a new development in the health care arena. And we tried to do the best we can. One of the philosophies we've had is that, especially for healthcare at Tapian, was that we should network. We wanted to be under one roof because we thought that the principle that we could work together as a group would always apply. So in other words, earlier on, Dr. King spoke about the pathologist being in the back story.
Right.
We will consult with each other, and we will knock heads together, and we will call people from down the corridor into the office and discuss, and we consult. Because you see, in medicine, one of the things is that if you can build a kind of a consultative approach among specialists, you are stronger, and you can move the patient further along faster, and you would not then be afraid to say, you know something, we can't do anything for you here, you need to go elsewhere to my friend in the other island, in the other country, in the thing. And we thought that this was what we needed to do, because some of us had come back practicing in a different space,
right.
And we needed to bring that space and this kind of environment into St. Lucia. So that introduced a new. What it did also is that I think the appetite of St. Lucians had been whet, in the sense that they were now demanding, even at the public services,
right.
Why can't we have the same care? And that was important. In fact, we knew that was going to happen. In fact, it was anticipated, and it introduced a new kind of element into the healthcare environment, which we were glad for, so that you could raise the bar, so that ordinary St. Lucians, those who could not afford, because really and truly, that was directed just about 10%, maybe, or 7 to 10% of the population, was what we saw as the clientele that we thought that would actually welcome private healthcare. Because what had happened is that if you go back to the legislation in St. Lucia, we had developed a colonial system where healthcare was free for the majority of the population in the public sector. In fact, it was enshrined in healthcare legislation 1985, which says that the majority of St. Lucians are entitled to free healthcare from their services. What I will tell you is that at the time, and I go, 1988 was when in the review that went along, what they said is that 7.3% of the GDP, no, it was 5.3, sorry, of GDP, St. Lucia was spending on healthcare. Interesting at the time, that was the same amount that Britain was spending on the healthcare. But the British had changed. They had introduced national insurance and all the thing and so on. So they had a structured healthcare system which was funded. But we were providing care which was not funded. And the question was, where are we going to get the money to pay for healthcare? Even the British can't do it, and without healthcare financing. But we had developed a colonial system, and that is still a challenge now, and remains one that we will talk about in a little while, because we need to be innovative and try to see how we can find the answer to some of those problems. So what has happened is this. We've learned from the past. We had put in a good primary healthcare system. It has fallen down, and simply because that a lot of people have died. The stalwarts have retired. They have died. They're not there, and even some of the others have not taken up the baton in the way those pioneers had done so. They did it with a lot of faith, hope, and charity. And I think they really did a good job. And I think we need to applaud them for all their efforts. So that was primary health care. In the tertiary care services, we had a number of casualties. We had, along the way, we had St. Jude's Hospital that was doing very well, and then the fire. And then that is currently with us. We still have that to grapple with, because it needs to, we think that St. Jude's needs to find its place as it had in the past in the healthcare environment. And we need to build it up in a way that we can have the hospital up to with the same sort of the reputation that it had in the past, where we need to rebuild it again. And that's one. Then we have other challenges. We have administrations change, and there was a need. And I think it's not to say that there was one administration and the other, but I think, to me, the pivotal thing happened in 1988, where there was a review. The review was done it was then the UWP at the time. The PS was Cornelius Lubin, the CMO was James St. Catherine, and I believe the minister was Romanas Lancico. But this was done, and they were reviewed the system, and some of the recommendations were built on by successive administrations. Okay. And what had happened, it was a journey, and the journey has continued. It is, I say it's a journey, because sometimes it's not just about a journey, but we should have, as our vision, a destination. And the destination is to try to provide as best a healthcare service that we can within the public and the private system for all of St. Lucians, because I think people deserve it. And of course, not everybody can afford private healthcare, but you need to provide care within the public service for them. And we, as St. Lucian doctors, as St. Lucian healthcare providers, we need to give our all and try to see if we can make both public and private a place where we can enjoy the good health care, so that it really things to the health of our country as a whole. Oh, yeah. Because this is a small country, and we need to have a marriage. Healthcare is really one commodity, public-private. It's people need to work together, and they must stop working in what I call a silo environment. Right. We can talk about the future, and Dr. King will give you his thing, because he has been a champion, really been a champion of universal health care, which is one of the offshoots that came out of this 1988 the review. And he's taken it step by step from 2003 up to 2006, when we actually produced. And Dr. King has been there in the forefront, but in the background, there's always a backstory. A lot of us have pulled, and it's many people. The person that comes to mind is Emma Hippolyte, who was then, she'd been We'd work together. There were others in the OECS Health Environment, Mr. Burnett. I was a part of that team, and there were many, many, many others, some of which people have migrated, some are still here, I have forgotten some of them. There were so many. But we've taken this, and I think we need to take it further, because the blueprint is there. The UHC, if you want to call it, declaration is there. It's a document that is thick and is full of ideas, and a lot of innovation needs to be done to make it happen. Because the longer we keep it there, the more we have to change things, because the environment changes so quickly. Now we have a new hospital that we are looking at, and we need to look to the future to see how we can make a transition. And I must say that one thing I would say, it's not going to be easy. Anybody who thinks that it is going to be heaven on the hill up there, they're fooling themselves. There's going to be a lot of teething problems. And in a country where we have no health financing, we have no money, no resources, I think we have to take a very realistic view of what we need to do. We need to you know what they say, you cannot put your hat where your hand can't reach.
That's right.
And I think that we must be practical, we must be focused, we must keep our heads up, going, and say we want the best. But if we want the best, there are sacrifices to be made. And the sacrifices is going to be, how are we going to finance the healthcare services to take us to a level of care where we can be proud of.
Definitely. Well, Dr. King, before you get to your part of the present, Dr. Didier mentioned his experience of how Tapio Hospital came together. And I just think I need to share with the public, you know, my own admiration for what Tapio Hospital has become, you know, and sometimes we doubt the quality of care that can be provided by our local practitioners. And I would say my own little experience of Tapio Hospital, working there myself, showed me how good we can be. And, you know, I'll share with the viewers one typical example. I was working in the ER one night, and I had a patient come in with chest pain. The nurse working with me, first thing she asked me, do you want the patient with chest pain to go onto the cardiac bed? I said yes. She said, do you want the patient to have an EKG? I said yes. She said, the EKG is pathology. Do you want the patient to have Plavix and aspirin? I said yes. She then said, do you want me to call the cardiologist? I said yes. And then I said, what else do I need to do? I said yes to everything, and I just went to my room. Yeah. And I think, you know, it showed how, for me, how if you have a great, well-trained team, you know, how everything can flow, and even the most potentially complicated of conditions can be managed so well, so efficiently. You know, I never had an experience like that, and Tapio, that experience at Tapio Hospital definitely showed me how good we can be, and we have the people here to do it. We have to take a commercial break, and when we come back, Dr. King will tell us the now, and hopefully we'll end the program with the future. Viewers, when we come back, we'll take your calls as well, so stay tuned. We'll be right back. Straight away to Dr. King, who will be telling us about his bit of what he sees in the present, and we'll look towards the future. Viewers will also be taking your calls.
I think as I speak about the present, I need to say that the present actually is a journey also, because in '97, when we went through the health sector reform process, I believe anyway, the philosophy is you must build on the past, and you cannot just do novo, go new. In that health sector reform, we had two key players, Cornelius Lubin and James St. Catherine. These were two players that you've heard before who were in the health sector for a long time. The same 1988 Stony Brook report was a crucial document in advising us on the health sector reform process. 2003, because in the Stony Brook report and in our health sector reform, we found out that people wanted to have a different way of financing. They wanted to share risks. They did not want to pay cash on delivery of service. Nobody wants to feel the insecurity of knowing that if I don't have the money, I don't get the service, I don't get the care, especially if my life is dependent on it. Right. So people don't want that. And we know as health providers that's not the way to finance healthcare. So 2003, we did more consultations and produced the Universal Healthcare Report. It's actually called the National Health Insurance Task Force Report. 2006, coming out of all of that, we produced the National Strategic Plan for Health, which was advised by a lot of technical personnel as well. So we reached now to where we are. Because when we produce a strategic plan for health, to get what's our vision, listen to this. A nation of people who are productive and capable of contributing to national wealth and development. Mm-hmm. We saw health as the underpinning of a people who then have the power to actualize and be successful and productive. And that we've all understood now. Mm-hmm. All great nations have great healthcare systems.
Definitely.
Okay? So we understood that. In fact, where we are now, we have now built, or in the process of finalizing the building of almost completely new health infrastructure. New mental hospital, new Turning Point rehab facility, new Owen King EU General Hospital, new St. Jude Hospital, right? New health centers, most of those health centers have been refurbished. A few more to go, but many have been refurbished. We have redone our health infrastructure. We have put a lot of health personnel in place. What we need to do now is management, coordination, and organization. There's a beautiful report, WHO 2000, which speaks to health systems. I would advise anybody interested in health systems to read that report. It's free online. But essentially, they make up a very important point. You've got to separate certain functions: finance, provision, and regulation. These are the three crucial elements in a health system, and they must be separated. Mm-hmm. Right now, they are not. And that's one of our problems. So in terms of
Welcome back, viewers. We're into the final segment of this very interesting program on healthcare past, present, and future. I will go straight to that. You would notice, and in fact, I stopped for a minute to notice that, remember, we said about politicians. The Prime Minister has announced that there'll be a bipartisan health sector financing committee of the Parliament, chaired by the Honorable Stephenson King. Right? And I'm supposed to be the secretary of that committee. It is time for that committee to work. That committee is a crucial committee at this point in time. I'm not saying it is a committee that has to bring all the studies that are going on now and those that have gone before on health sector financing, bring them together to come up with a coherent plan as to what we are going to implement. Because this year, we must get it right, because the hospitals are opening this year. Right. And they're going to sink the health system if we don't have the right financing in place. And for that matter, they'll be so underfunded that they will barely be able to operate. You only have to witness what's happening at St. Jude Hospital right now to understand what poor financing can actually do and how a country cannot sustain the level of financing that is absolutely necessary to deliver the kind of care that our people expect, right, and for that matter deserve. That committee must be started. Now, Stephenson King, as an aside, is an interesting gentleman to put to chair. You may remember in the early 90s, he took us on many a retreat to discuss how to improve the health services.
That's correct.
Kept us talking till 3 o'clock in the morning some nights, if you remember.
Yes, yes,
about
yes.
10 of us he had,
yes.
Right? And which was great. It's not often you get ministers that will give that kind of work. Stephenson King cares about the health system. He showed us that at that time.
That's right.
He developed with his team the National Health Insurance Act, because he wanted to bring in health finances as national health insurance. That is what we reviewed in 2003 when we did the task force report, and realized that that is not the way to go. We cannot go that way, because we have too many people who are informally employed or unemployed to expect to give universal care to everybody from a salary deduction system. Because Peter paying for too many Pauls. Mm-hmm. It's not good sharing of the risk.
That's right.
Okay? So anyway, also he's Prime Minister, Minister of Finance. So I think since then, so he has a good idea about financing. So I think he's a good person to put there. What we're going to have to do is I believe Dr. Didier mentioned about how this is one country. The phrase I use now is one country, one health. We can no longer afford the divisions and the halekase and like two buoy pulling in the opposite direction. We're going nowhere like that. We must come together. We must create the management systems which allow us to harness all the power that we have. So the provision of healthcare services needs to be rationalized properly with a clear continuum of care from community right through to the hospitals to overseas care in a clear, understood pathway that with clear protocols, clear procedural steps, clear ways in which we keep people as well as they can so they don't have to come to hospital, and yet when they do come to hospital, they know that they get exactly what they require, when they require, as quickly as they can, so they can get out of hospital as quickly as possible, or can be referred to our allies, our service providers outside the country.
Right.
In that same process, though, in that same continuum of care, the system we design must also build local capacity. Right. So it must cause our local healthcare systems to grow. Right. It cannot be that you send your money overseas and you provide healthcare overseas and you fatten other people in other systems. We must grow ours, but we understand our constraints of size and resources, and, both financial and human. But we must grow it over time so that our children can inherit a system that is healthy and growing. This is a challenge. There are a number of options for health financing on the table. Barrett from PAHO pointed out that going for, like what the Jamaicans have done, for certain taxes on certain products, tobacco, alcohol, cell phones. We used to raise $19 million by taxing cell phones in 2010. All right? He says we could raise another $12 million from tobacco. We can probably raise another 20 million or so from alcohol. And the beauty of, for me, the beauty of taxing those things is explain to me why we shouldn't pay more for tobacco or for alcohol, or for that matter, the cell phone. I see no reason why not. But these are the things I must tell St. Lucians. These are the hard decisions and discussions we're going to have. Because money does not just come from the tree. Money comes from our hard work and our pockets, and we have to pay for what we want. What we must do is, so to summarize for people, we have to put a well-managed system in place, a system that understands that the Ministry of Health can hold the providers accountable, and there's separation between Ministry of Health and the providers. Right? There's continuity of care within the providers, public, private, community, hospital, and overseas, a continuity of providers. So we have a provider network, right, for want of a better word. And of course, we now look to the people and say we want universal health care, which is a limited package of services. The more money we have, the bigger we can make it. Therefore, now the people must now decide how much money and how they're prepared to pay up to finance that service. We can tell them this will cost you. We estimate it's going to cost an additional 40 or so, 42 I think it is, $1 million a year. We presently spend about somewhere around 110 on the recurrent expenditure in health. We have to go up to about 150, given the systems that is. We might be able to achieve some savings by doing more efficient things, and definitely by putting more people, keeping more people well and keeping more people out of hospital and in community. Comes back to the continuum of care and the need to integrate hospitals with community services. Right. All right, when we move forward with this management. So we might be able to save some money, but we're still going to have to put up more. So we as St. Lucians must make a decision how we want to pay. When we did the reform consultations, Andre, we went into every community and spoke to everybody all over. They all said they don't mind paying, but they don't want to pay, they don't want to be held hostage to the payment. When I'm sick, when my child is sick, you're now telling me I must go and find $1,000. No, don't do that to me. So, okay, now we're going to put them to the test. People, you told us that. We're going to be coming back to you and saying, okay, fine, since you told us that, here's how you're going to have to do it. So it's going to be taxes, which we think is the best way to go. It might not, I'm not saying there was a talk about going to VAT, but I think you may or may not have to go to VAT. We might be able to do it with other taxes and other levies outside of VAT. Now, there may be some people, some finance people might be cringing right now, saying we don't want to have no more additional taxes put on. But at the end of the day, and this is where I think it's so important for us as St. Lucians to stop and think. We are an independent, sovereign nation. We're a people on a mission. We are people that need to know where we're going. And in this health sector, we have to be very clear, and I'm trying to be very clear to people. We are trying to create a health system that everybody can access. So there's equity. And everybody can get the quality of services they require when they require them, such that they can remain as well as is possible, given their condition, so that they can remain in work, in family, in community life. Right? If that is what you want, and you're committed to that, then you all have to work together and make sure that we are prepared to make the changes that are necessary. We're going to have to make sacrifices. Dr. Didier and myself are going to have to make sacrifices. So are you, Andre. So is the Minister of Health. So is the Ministry of Health. But we must be willing to make these sacrifices. One of my biggest problems with the present health system as we're moving forward, and my biggest problems with my country, is I find the unwillingness, the weakness of decision making. The tough decisions that have to be made with good understanding and with caring, but they must yet be made. So I should be able to explain to you exactly why you must make this tough decision and why you must make this sacrifice. In whose interest are you making this sacrifice? You, your children, and those that are yet to come. Right? But you must be prepared, and I must be prepared as a leader to tell you that and show you that, and you must be willing to follow. And that's what we need in our leaders right now. Good, clear decision making with good, clear plans that we can all look at and hold everybody accountable to, with checks and balances in the system. I see greatness for us, but I also see the flip side. I see more pain and suffering. The only thing that's going to make that coin flip the right way and be our greatness is our willingness to do just that, to understand the issues and make those sacrifices.
Yeah, I think that there are many challenges moving forward that we need to be prepared to face. There are going to be a lot of stumbling blocks, but I think along the way we must use these stumbling blocks as stepping stones to move ourselves to the higher level. There is a need for public, private sector, all St. Lucians to get together to use all the innovation that we can to achieve what is actually a vision for the healthcare system, to improve the healthcare. And I think it's going to take not just taxation. There is a need to engage the insurance industry in the private sector.
Good night, caller. You're on the air.
Yes, I just came in. I just stepped in only to meet Stephen in his presentation. And I had to call because one cannot emphasize exactly the sentiment Dr. King is speaking about. I mean, we have a population where persons make noise as opposed to, with regards to a $3 difference increase in water, and they expect a 30-year-old structure to remain effective and efficient. You know what I'm telling? And by and large, every person who have a problem with paying $10 for 1,000 gallons of water as opposed to 7 have bought a bottle of water for $3. So what I'm telling you, less than a gallon.
That's right. That's right.
Yeah.
That's right. That's right.
Make noise about the fact that there's a 10 cents or 5 cents on sugar, yet still everybody passes 5 cents and 10 cents on the street and never pick it up. We have to, as a people, realize that it is ours, and we have to give in order to give out. Persons talk about the hospital, yet still they have $50, $80, $90 in their pocket, and they wouldn't pay $20 to the doctor. They figure it's supposed to be free. Notwithstanding, you say the doctor has to be paid, the structure has to be kept. We need a massive education campaign. Believe it. Things you think people know, Mr. King, they do not.
Yeah.
You expect people to purport and carry themselves a certain manner as obvious. It is not obvious, my brother.
Well,
we have to build a country from scratch.
The other thing, caller, that we need to do is we have to get our priorities straight. I think we haven't, and I think we've lost along the way. We will have a big event, and we will spend all these things on clothes and dress and drink and so on, and we will not, whereas when it comes to our own health care, we forget that if we don't have the health care, we can't go and enjoy those things.
Correct.
And, you know, it is, so we really have to get our priorities straight. I think we somewhere along the line, we've been lost, and we need to refocus on what is actually very important.
Good night, caller. You're on the air.
Good night. I just want to, I've been enjoying the program, and I just want to thank the doctors for the journey they've taken us on tonight, their own journey and the journey of the history of our health sector in St. Lucia. I want to also make mention of some of the names that I heard them call about Cornelius Lubin and all of those persons who have, have been very committed when it comes to the health service that they are giving to our people. I particularly want to say, to join with Dr. King in saying that it was a good thing, a good decision to have chosen Stevenson King to lead that committee, because as a Minister of Health, he was very committed to health. But let me just tell you, Dr. King is not only health that he's committed to. He's committed to a lot of things, including education. And I want to say to Dr. Matthew, I admire you as a young man, and I know you're going to be a great doctor, just like the two other doctors you sit with and other great doctors that we have in St. Lucia, working in the public health sector, trying to make life a better life for all of us St. Lucians. Wonderful program, and I'm enjoying it.
Thank you very much.
Thank you, caller.
Yes, thank you, caller. Both callers. And Andre, Sir John Compton, I remember, we went to cabinet in 2006, I think it was. And I was presenting the then strategic plan for health to the cabinet of ministers. They had just come in. And boy, the fellas give me a rough time. This was Spider, you must remember that. But anyway, he said something. After all the day, he told them, he said, Dr. King, just tell him without health, you have nothing.
Yes.
It's a good point. Wise words, and you were saying it. All your thing, you don't have your health, what are you?
Exactly.
What are you when you are dead?
That's right.
What are you when you are sick and disabled, when you've had a stroke? So that's important. Now, and Dr. Didier was reminding me, as we were talking there, that in health sector financing, we also have to, and without telling any tales out of school and giving any details, the private health insurance industry. That's an industry that we can grow, and we can grow with it.
Right.
So we can use it as a means of finance. Sorry.
Yeah. It's one way of getting...
Caller, you're on the air.
Yes, good evening.
Good evening.
Good evening, distinguished panelists.
Good evening.
Thank you.
And special good evening to you, Dr. King.
Yes, my friend.
Yes, I like the vibes. I like your enthusiasm. And what a way, because I know you came from an esteemed medical family.
Thank you.
And then you have you have emphasized that. But if there is one disappointment that I have had, Doc,
tell me.
As regards to the health reform, healthcare, I think it was something that was on the agenda with the Labour Party prior to the 2005, before the last general elections. And then when the other administration came in, it was kind of shelf, and I believe it's unfortunate, but I'm happy that it is back on the shelf again, and it is being led by you and also Dr. Didier, who has done some fabulous and marvelous things for the health sector in St. Lucia. And in closing, I would also say that the former Prime Minister in Stephen King, I have had a lot of time for this gentleman, and I'm happy to know that he is one that will be working alongside that health reform. I think it is something that we need in this country, and a healthy nation will be a wealthy nation.
For sure.
If your nation is not healthy,
then you
look for,
yes.
you're asking for trouble.
Very true.
And in closing, Doc, I think you have led the charge, but something I would like to see that is pushed more in this country, the lifestyle of our people,
Yeah.
as much as not only the exercise, but eating the right
course.
the right food. Good evening, gentle people.
Yes.
Thank you very
Well,
much.
it's a very good point. I mean, the couple of things that I would say. We were talking earlier about how are we going to finance these challenges that we have, and I think we taxation is one, but that's not going to be the answer, because we won't be able. We need to involve the private sector in the terms of the private insurances, and the governments will actually have to work to ensure that the private companies have insurances for their people, their staff, and so on, and so that even the public sector can charge fees to the private insurances, so that can help to finance the public sector. I think it's going to be a mix of a lot of things. It cannot be one. We spoke about earlier about the sin tax, which is the one on alcohol and thing. And in Jamaica, that has worked very, very well. If you talk to Barrett and his group, they said that has really generated a lot of money for the healthcare sector. And so that's one. So we need to put our collective heads together, because one thing we are not short of in this country is brains.
Definitely.
I think we have a lot of going for us that we need to do. The other thing is that I think the caller is right when he says that you need to have more health promotion in prevention.
Good evening, caller. You're on the air.
Yes, good evening, doctors.
Good evening.
Just one question. Do you see the allied health profession adding anything to the provision of healthcare in St. Lucia in the future? Thank you.
Yeah.
Thank you for your call.
The allied health profession is a very large group. And yes, the allied health profession has value to bring to the table, as do all other healthcare providers. Because the allied includes all our medical technologists, all our radiographers, all our physiotherapists, chiropractors, herbal practitioners. There's lots that
nutritionists,
the
massage therapists, podiatrists. I mean, it's a large. The sector is not just about doctors and nurses. That used to be the old way of thinking. What you need is a holistic approach to the practice of medicine, and the holistic approach will actually lead to more health promotion, better wellness. And better wellness actually means that, because prevention is always better than cure. I mean, curative medicine is expensive.
Correct.
And it actually is the end stage. And if we need to go back, and we need to do both. We need to, in a small country like ours, we need to do a lot of preventative medicine to be able to because if we don't do that, we will not be able to afford the curative care.
Okay, so we'll have to take this last call and we'll give our final words. Good night, caller. You're on the air.
A pleasant good night to all.
Good night.
I have a question, and you Dr. King said it earlier. It's about part of what he said was three words used: saving lives, and I can't remember the other two right now. But I go to the saving lives, and would love to hear the doctors in perception of what is the first responders, and the feel to what probably needs to be worked on, improved in the aspect of the fire service as the first responder, because first responders are critical. 9/11 was talking about.
Maybe I can kick off on this. I think.
Thank you, caller.
I think the caller is perfectly right. One of the things that needs to happen is that I do not believe that you should have the first responders absorbed into a public service like just the fire service. Now, you can have, maybe because we're a small country, you can have one service, but you must actually try to separate the two, because the first responders are actually very, very, very important. The other thing is that the time may have come whereby first responders may have to be part of your Ministry of Health. And in fact, and if not part of the Ministry of Health, what needs to happen is that whether it is national security and health, if the problem is financing, then the first responders have to be financed by both ministries. And I believe that because you will need to do that. The other thing too is that as we come to a new national hospital, the importance and the role of the first responder is going to be much more important, because you're going to have people coming out from the districts, from the secondary care centers, who need to get to the national hospital in a timely fashion. And there's always this golden hour that we talk about in medicine. So I think what has to happen, and it's something that has been a thing of what I've always said. I believe that in St. Lucia, the ministries seem to work in silos. You know, talk about you in your section, I in my section. We need to work together so that, because a lot of the times, a lot of what they're doing is duplication. So, you know, you need to work together to be able to bring the service to the people, however you do it. And it probably means that you may have to think your healthcare, your resources together, your personnel, so that you can respond. The other thing is that the hospitals will have to have a system of first responders as well. So there's a lot of thinking that needs to be done. The only thing that is looming on the horizon is, where is the finances going to come from? And that is going to be the real challenge that we're going to have to face.
Just 3 things that I know, because I know we have to close, right? Just 3 things. On the emergency medical services, this was something I remember Dr. Lisa Charles, who's another champion in this area. She's the present medical director at Victoria Hospital, worked very closely with Lambert Charles at the fire service and myself, I was CMO at the time, to bring together an emergency medical services program so we could have a coordinated national approach to urgent care and emergency medical service and so on. We did that capitalizing on the World Cup initiative to actually do training and purchase equipment, which we did. But what we didn't do or didn't get done was the bringing together, the coordination into the one program.
Yes.
To me, you have to have one program. It has to have clear medical direction. It has to have good central dispatch, professional central dispatch, and it has to have good communication with the emergency rooms wherever they are in the country.
Right.
Right? So we can, and in addition to that, to me, we need to be moving into even beyond ambulances, and we should be looking at the helicopters and these other things as we develop that service as a professional EMS service, and that is what they do. I don't really mind whether they're fire officers or health officers or whatever, but it must be one program, one set of protocols, one set of dispatching, one coordination, one system. And I don't believe that people should have to pay $50 to go on an ambulance. Yes. I think ambulance services should be absolutely funded.
Yeah,
absolutely funded. And UHC has to do that. Okay? The 2 other things I just wanted, because 2 other callers called in, and one for Dr. Didier. I fully agree that the Allied have a role to play in the holistic comprehensive care. My thing to Allied Health Services is it must always be scientifically based on evidence, based on scientific. I do not like the charlatan approach, the conning approach that can occur as masquerading as some professional branch of the Allied Health Service. That we must call it out, call it as it is, and say that is not science, that is fake. Don't do that to the people. Don't do that to the people. And the council is supposed to license and make sure that doesn't happen, so only professionals, herbalists and otherwise, are acting in this area, naturopaths, whatever, but professionals. Don't market yourself as something that you are not and take people's money. And worse than that, I'm not even so worried about their money. I'm far more worried about their life and their limb, because I've seen too many people hurt in our country already. So that must stop. Now, that's a challenge to whoever's out there that does the regulation and to all of us.
Definitely.
The other thing is in health financing is the health industry. Not only do you have taxation and private financing, but there's also the health industry, medical education, research grant fundings that can be brought, proposals that can be written. Health is a wonderful place to which you can develop a whole new set of ways of getting revenue. And that must be, and we need the machinery, we need to put that machinery in place so that we can actually source the grant funding, do the various bits of research which build our capacity and provide services, as well as doing our medical education, which brings great streams of revenue into the providers of the health service, hospitals and community. These are the things that we need to look at also as we go forward.
Yes.
Oh, yeah. Beautiful. So I think we're going to close. This has been very, very informative. Viewers, if you've missed part of the program, it will be rebroadcast next week, Tuesday. But I think we'll close now with your final comments. Dr. King, we'll start with you.
Okay. My final comments is, my people, it is time. This is our time. This is our testing time. We're either going to get this right, we're going to pull together, or we're going to fall apart. I truly believe, when I look at the history of medicine in this country, the history of our St. Lucian people, I think our greatness is there. I think we've always been able to do it in the past. And I know we can do this again. I think it is now. This is another time when the history books are going to be written in the future. They're going to be talking about this time. And our decisions are going to be recorded. And our great-grandchildren and their children are going to look back and say, just like we speak of the greats of the past, they will speak of those that those of us that made the right decisions or not, and judge, or history will judge us accordingly. So I hope that we get it right, and I'll be more than happy to play my own part as I can, Andre, as you know, as long as God gives me the strength and the power and the blessing to do so.
Oh yeah. Thank you, Dr. King.
Well, in closing, what I will say is that I think the next few years for St. Lucia in the healthcare services are going to be very challenging. And there are some realities we have. We have a new institution. So we really have to face up to the challenge. What we must not do is set our expectations so high that we ourselves feel disappointed. It is really going to be a journey that will take us on a final destination. And the final destination is actually going to be better health care for all our people. And we must stop looking at our country in terms of colors or parties. We must look at ourselves as St. Lucians who want to develop a society where we get the best of care, health care, for all our people. And there are some who can't afford, there are some who can afford. And what we need to do is to be able to try to see if we can face those challenges for the future.
Definitely. Thank you very much, Dr. Didier. So to both of you, I think I need to close this program saying thank you for your sterling contribution to healthcare in St. Lucia. Simply said, I can't imagine what healthcare would be like today if it wasn't for your contribution. Definitely can't imagine. So,
well, it's been a privilege.
It has.
Yes, it really has been a privilege.
Thank you very much, Andre, for the show.
Thank you.
Thank you.
Okay. Bye.
Viewers, you are watching Pulse live on Choice TV. It was another wonderful program. See you next week Tuesday for this rebroadcast, and we have another live program for you that following Tuesday. Good night, viewers. Thank you for watching.